My name is Patrick McClister. I'm from Frederick, Maryland, outside of Washington, D.C., and I'm an attorney in Frederick. And about 2 months ago or so, I was playing basketball and twisted the wrong way, and my whole right leg went numb, and my upper thigh was very weak and sore. And I'm used to having strong legs, but my right leg was basically, I had to just pull behind me. So I went straight to an orthopedic doctor in our town, and they wanted to do a kind of a traumatic type surgery, I guess. And then I balked at that at first, and then they talked about doing an epidural and some other minor procedures prior to doing a surgery. So I was reluctant to go through that once I talked to some friends who had been through the spinal surgery route, and especially a good friend of mine from high school who's in very much pain. And I'm 54, so is he, and he's can't do much these days because of his back surgeries. So my wife and I, my mother, we looked on the internet. We were finally saw your website, and we were very impressed with this new approach. We were kind of skeptical, and we looked all over the East Coast to see if anybody else would do the non-traumatic approach, but it wasn't. We couldn't find anybody that would do it to this type of approach. So we inquired and talked with Darren, who was the office coordinator, and he kind of answered all of our questions and put us at ease. I talked to Dr. Ditzworth on the phone, and he answered most of my questions. I was very impressed with any questions that I had. He was willing to answer them. So we decided to give it a try. And so here we are about 2.5 months after the injury, and had the procedure yesterday. And it was about a 3-day procedure where I had to come in and do some paperwork and get checked out. Second day was a discogram, and that was, I didn't feel any pain with that. And then yesterday was the procedure. So today I'm talking to you after I had the procedure yesterday morning, and I feel great. I don't have any pain. I slept fine last night. I can feel stronger in my right leg right now, and I'm sure it'll get stronger over time. There is a system that Dr. Ditzworth was talking to me about after surgery. There's about a 8-week type program that they recommend, so I'm anxious to get started on that. But I would say that the staff was very friendly, very knowledgeable. Couldn't have been nicer, and couldn't have been less pain-free from my standpoint. So my family was here with me, and anytime they had a question, they got it answered, and they were treated very kindly. So I'd highly recommend Dr. Ditzworth's procedure.